Jump back. Thank you guys. All right. So hello, everybody. This is the Law Offices of Samantha Wolfe, and thanks for joining us this afternoon. Today, we're going to talk about adventures in Medicare. And so it's kind of timely. Yesterday was Father's Day, so happy Father's Day to all the fathers on the call. My dad and I spent yesterday together, and when we were coming up with seminar topic ideas, my dad will be 65 in July. So we had the fun of trying to apply for his Medicare. And I say trying to apply because I think it's always difficult to apply for Medicare anyway. But the benefit that we used to have is that people used to be able to go into the office, the Social Security office, and apply that way and get immediate results, get all their questions answered. And with COVID happening, that's not the case. So I thought it would be really helpful for me to not only talk about it from a legal perspective and what Medicare does, but to also talk about what my personal experience was helping my dad apply for Medicare. So that's what we're going to do today. And what we'll do is I'll go through the slides, and then I have some time at the end. We'll actually stop recording. So if you want to jump on with your video and ask any questions, you're welcome to do that. So thank you all again for jumping on. Let's get started. So I wanted to start first by saying, what is Medicare? So what are the characteristics of the Medicare system? This is important because a lot of times when I'm talking with clients or financial advisors, they may use the word Medicare or Medicare and Medicaid interchangeably. So I wanted to talk about what exactly Medicare was, and as a result of that, touch on what Medicaid does a little bit so that we can make sure we understand the difference. So Medicare is a federal government program that provides healthcare coverage for qualified individuals. So if you think about it, it's just like health insurance, only you have to meet certain criteria or be a certain age in order for you to qualify for Medicare. That's different from Medicaid, and we'll talk about the particular differences, but the main thing to know is that Medicaid deals with more long-term care, and it is more asset-based than Medicare is. So Medicare is administered by the Centers for Medicare and Medicaid Services. And I don't know why when they instituted these programs, they didn't choose more different names, because I think that is part of the problem, is that they have names that can be interchangeable. And sometimes people even say medical assistance, and they might be meaning Medicare when they say that. So enrollment in Medicare is through the Social Security Administration or through the Railroad Retirement Board. Most clients that we deal with, it's through Social Security Administration. And originally, when Medicare was designed, it was designed to kick in the same time Social Security did. Now, as people have lived longer, we've had to almost separate the two programs, where it used to be that if you qualified for Social Security, of course, you were able to get Medicare. But as more and more people aged and people were living longer, there was almost this separation, two different train tracks as it dealt with Medicare and Social Security. So Medicare is a fee-for-service payment system. It uses the red, white, and blue Medicare card as the actual insurance card. I put an example there off to the right. And it allows people to receive treatment or services at any provider that accepts Medicare. It does, though, mean that there are going to be certain deductibles and co-insurances that may apply, and beneficiaries may want to purchase additional insurance to cover those out-of-pocket costs. So in order to be eligible for Medicare, you have to be 65 years of age or older, or under 65 and receiving disability benefits from the Social Security Administration or from the Retirement Railroad. And you must receive these benefits for 24 months before eligibility for Medicare, although there is an exception for ALS. Or you have to be under 65 and diagnosed with end-stage renal disease or be receiving a kidney transplant. So most of the clients that we work with who are eligible for Medicare are going to be the 65 years or older. The components, it actually has multiple parts. This is the other thing that confuses clients, is what do the different parts do? What do they cover? So part A is hospital care. So if you think of it in the context of, it covers inpatient care or any services that you receive as a result of like an emergency room visit or any type of hospital treatment. That would be part A. Now, the interesting thing is I'm just going to take a second to talk about how Medicaid comes in here. So part A of Medicare is going to cover For example, if we have a client who's admitted into a hospital, if they have a 3-day stay, it has to be a minimum of a 3-day stay, then Medicare will cover up to 100 days of their long-term care treatment. Once you get to the 100 days, then Medicaid is the program that you have to be under. And either you're going to privately pay if you don't qualify for Medicaid, or if your assets are below a certain amount, you have below a certain amount of income, then you'd be able to qualify for Medicaid. So that's how Part A of Medicare and Medicaid work. So Part A covers just up to 100 days under Medicare, and then anything after that's Medicaid. Part B of Medicare deals with medical care. So it covers outpatient care and services. So Medicaid doesn't typically cover this. The Part B part of Medicare is what covers outpatient care and services, although there are going to be some exceptions that we'll go over. So Parts A and B are usually referred to as traditional or original Medicare. So back when this program was originally created, there was Part A and Part B, and that's now called traditional or original Medicare because there are other options. And we're going to talk about that in a second. So what basic Medicare does not cover? So routine eye care, routine dental care, hearing aids, and those exams for fitting hearing aids, which is a big deal. We have some clients who, it's thousands of dollars to get hearing aids, and Medicare will not cover that. It also doesn't cover, like we said, long-term care. So after you've had a 3-day hospital stay, and you have to be admitted for a minimum of 3 days. So one of the other things we run into with clients is they might be only admitted for observation and not actually admitted into the hospital. And if they're only admitted for observation, then it doesn't trigger the requirements for Medicare to cover. So whenever we're having a client who is looking at long-term care, the question is, did Medicare initially start covering? And we've represented clients on both sides. So we had one client, for example, who was coming from the community, meaning they just realized that they wanted long-term care services and support by going into a facility like Quincy. So Medicare didn't start covering them because they didn't have that 3-day hospital stay that triggers the Medicare coverage under Part A. So long-term care is traditionally not covered under Medicare, and that would be if you don't have the 3-day hospital stay, or even if you do and you're maxed out your 100 days, then Medicare is not going to cover any long-term care. Medicare also isn't going to cover any care or services that are not recognized by Medicare as medically necessary. Now that's always problematic because certain treatments might actually be necessary, but again, it's all about how Medicare defines it. Does Medicare define it as medically necessary? The cost to be in Medicare, so there's a Part A and Part B, and there are premiums for that. So when I was sitting down with my dad, you can log into the Social Security Administration website, and you can find out how many quarters you have worked. And if you've worked 40 or more quarters, then there's no premium for Part A. So 40 or more quarters, and you get that Part A, which is that hospital care, you get that at $0. There's zero premium for that. If you've worked 30 to 39 quarters, then there's a premium of $259. And if you've worked less than 30 quarters, then there's a premium of $471. Now, what's interesting is my mom was generous and gracious enough. She stayed home with my sisters and I when we were growing up. So my mom doesn't yet have 40 quarters. Now, the thought is by the time she actually qualifies for Medicare, she will have her 40 quarters in. But if for whatever reason she does not, and she only has the 30 to 39 quarters in, she would have a premium for the Part A, which is that hospital care part of the Medicare. Now, when we go to a skilled facility, what's important to know is that Medicare coverage, again, you have to have the minimum 3-day hospital stay, and then Medicare will cover up to 100 days. So day 1 to 20, there's no copay for that. Days 21 to 100, it's $185.50, and that number goes up every year. It's a daily amount. So daily amount in excess of the deductible, there's a copay. And then day 100 and beyond, Medicare does not cover. You would have to either privately pay or qualify for Medicaid at that point. So Medicare does not cover long-term care, nursing home care, dental, vision, or hearing aids. And a lot of times, again, clients need things that fall into one of these categories, and Medicare won't cover it. But as we're going to talk about, you may have a Medigap or a supplemental insurance that will cover those certain items. I wanted to put this in here. So this is a court case in Pennsylvania. We call it the Gimino case, and it was a settlement that came out. So it used to be when I first started practicing that there was this standard in which Medicare would cover. So they were previously saying when I first started that if the patient's condition did not improve, so if you hit a plateau, they'd say, you'd hear the term, oh, well, the client has plateaued. And if they've plateaued, then Medicare no longer covers it. So you can get up to 100 days, but if the rehab or the physician is saying, you're not improving, then Medicare would cut off prior to the 100 days when I first started practicing. This court case was really helpful because it said that coverage cannot be denied based on the absence of potential improvement. So it's no longer a plateau standard, meaning that if you've hit this plateau and you aren't going to make any other improvement, Medicare goes away. What it now says is that if you're staying at this plateau, but you need this rehab or this treatment to maintain where you are, meaning it doesn't necessarily mean you have to improve, just to maintain what you're doing, then Medicare covers it up to 100 days. So the good news is that most of the time now facilities do understand this, although you'd be surprised how many facilities still want to discharge someone because they're claiming that there's been a plateau of treatment and the clients or the patient's not getting any better or there's going to be no improvement. And so usually it just takes a phone call from our office to say, well, no, based on this court case, they still qualify for Medicare coverage as long as they need this, but for this type of rehab or treatment, they would further deteriorate. So again, it's all about making sure that it prevents or slows further deterioration. It has to be what's reasonable or necessary. So Medicare can be really helpful because it allows time for families to get the long-term care options in place, whether it be admission into a long-term care facility or whether it be they're going to be just discharged home and you're going to have somebody coming in and caring for that person at home. And they cannot be discharged from a nursing home or long-term care facility if it's unsafe for that person. So that's the other thing to remember when you're meeting or advising clients is that, again, there's no longer the plateau standard and they do have to be discharged to a safe environment. So what is Medicaid? Medicaid is a state or federal program that pays for healthcare services, but it's actually administered here in Pennsylvania through the Department of Human Services or DHS. And most people that need long-term care are going to eventually qualify for Medicaid. So after their 100 days of Part A coverage under Medicare, they're either going to private pay until they've spent all their funds and then they qualify for Medicaid. Or if they've done some pre-planning, they could qualify for Medicaid immediately after the 100 days of Medicare, that coverage is complete. And 2/3 of nursing home residents are receiving Medicaid benefits. So I didn't want to spend a whole lot of time talking about Medicaid because I know we've talked about it in virtual seminars in the past, and you can find them on our YouTube channel. But I wanted to touch on it here just because, again, there's that people tend to interchange Medicaid and Medicare. And so I wanted to make sure that it was really clear that Medicare is the health insurance program. Medicaid deals with long-term care treatment. And we're going to talk in the second half of the presentation how you can have somebody who actually is on both Medicare and Medicaid. And the difference is the Medicare is for the health insurance, the Medicaid is for the long-term care part of it. So we've talked about Medicare and we've talked about the Part A, which is the hospital care that you're going to receive in the facility treatment. Part B is going to be those outpatient services. And so there's going to be a premium for the Part B of Medicare, and that depends on what your annual income is. So this, again, it changes year to year. So what I did is I put an individual, a joint, and then what the premium is. So you're going to see as you look at the column on the left dealing with the premium goes up as your income goes up. So it is, even though they don't count your assets, in some ways it is a need-based program, meaning that if you have less income, the premium will be less for the Part B. And those are those outpatient services and treatments. So how do you pay for the Part B premium? Well, it can be deducted monthly from your Social Security amount. It can also come from your railroad retirement or federal retirement benefits that you receive. So again, every year, typically a client will receive something that says this is the amount that's going to be deducted from their Social Security for the Part B premium of the Medicare. And that can change depending on the income. So I actually practiced for a while up in Williamsport, Pennsylvania, and there they were dealing with the Marcellus gas boom that was happening. And when those clients would get royalties that they couldn't really predict, depending on what their income was in a year, it would affect their premium. So either they'd be paying more or less. And we actually had some clients who would get really upset and they actually wouldn't want to receive those funds because it would potentially jeopardize their premium. And again, it wasn't something that you would know until, because it's based on the previous year taxes. So you would know it every year what the premium is going to be. If it's not deducted from your Social Security, from your railroad retirement, or from your federal retirement payments, then you're going to be billed every 3 months. And there is a Medicare Easy Pay option that deducts it directly from your bank account. So again, Medicare Part A, there's no premium if you've worked 40 or more quarters, but Part B, there may be a premium, and that's based on your adjusted gross income annually. So how do you get into Medicare? And it's not as simple as you think. So again, my dad, all of this came about, putting together this presentation, all came about from my dad's experience. And I actually sat there with him and helped him apply for Medicare, and it was still confusing for him and for me. They don't make it easy. The portal that you have to go through is a little confusing because if you're not someone who's also applying for Social Security at the same time, then it's a little bit different than if you'd be dual enrolling in both of those programs. The other component that made it difficult for my dad is that he's still employed full time and receives benefits through his employer. So it was a question of, would his employer still cover him? Would it be the employer's insurance that would be primary or secondary? And my dad was concerned about the penalty if he didn't properly enroll. So all of these things were happening, and it made for a very stressful Sunday afternoon when I was applying online with them. So enrollment is handled two ways. So there's automatic enrollment, and then there's enrollment by application. So automatic enrollment happens if you're already receiving Social Security benefits, whether it be disability or if you're receiving railroad retirement benefits, then you're automatically enrolled in your Medicare. If the beneficiary receives an initial enrollment package 3 months before their 65th birthday, so the 25th month of disability benefits or before age 65, that's their initial automatic enrollment period. So if you have any of these things, Social Security benefits, Social Security disability benefits, railroad retirement, then you're going to have that automatic enrollment. And they will do that 3 months before age 65 for you. The other way you have to do it is enrollment by application, and this is how my dad had to enroll in it. So he's not receiving benefits through the Social Security Administration or through the Railroad Retirement Board. He didn't work for the railroad. So his initial enrollment period is 3 months before turning 65. So my dad's birthday is about midway through July. So I think maybe I get this from him when, the 3 months hit, 3 months prior to his birthday, he immediately felt very stressed out that he needed to apply for Medicare. 3 months before you're turning 65, you can do it. The month the beneficiary turns 65 or 3 months after turning 65. That period is called the initial enrollment period. So it's a 7-month period there. That's your initial enrollment period if you're enrolling by application. Now, again, automatic enrollment, you have an initial enrollment period, but you don't have to worry about having to take steps to enroll in Medicare. And if your birthday is on the first day of the month, then you do get another month previous. So again, that can change it a little bit too. You may not have 7 months, you may not now actually have 8 months. So, but my dad's birthday was not July 1st. So his is about midway through July. So come April is when he started to stress about it. And I can tell you that we applied for him on April 11th. And I marked it down because I had to keep track of his login information and make sure that he was getting all of the notifications that he was receiving. So this is just a little chart that shows you. So the reason my dad was so stressed out about it is if you enroll the 3 months, anytime in the 3 months before your birthday month, then there's no delay in receiving the Medicare benefits. If you do it in the month you turn 65 or the 3 months after, there's no penalty. However, you have a delayed start for the Medicare benefits. So to have Medicare coverage for the month you turn 65, you have to sign up 3 months immediately prior to the month that you turn 65. Waiting until the last 4 months of the initial enrollment period to sign up for Medicare will delay the start date for coverage. So my dad wanted to get it that first month that you could possibly enroll. He wanted to do that. So that's why we did it in April. So again, it's a 7-month initial enrollment period. Now, normally you can file your application in 3 ways. Now, I say normally because COVID has messed that up. So you could apply in person at the local Social Security Administration office in Chambersburg, here for Franklin County. And there is a directory, if you're not located in Franklin County, of where your Social Security Administration office is. The problem is that during COVID and even now, those offices are closed to the public. You can't walk in and have somebody help you with your application. You can either apply by phone or apply online. So using the number I have listed on the screen, or you can apply online at that web address. The issue with those two things are that applying by phone, the hotline is handling only critical issues, and that's not including new Medicare applications. So you can't apply in person right now. Their field offices are temporarily closed and haven't really told us when they're going to open up again for applying for Medicare. 2, you could apply by phone. So my dad and I could have done a call, except you can't when you're applying new for Medicare, which is also problematic because we have some clients who've tried to do it online and it won't let them. So there's some underlying issue with their application, so they end up having to call. Or you can apply online, which is what Dad and I did on a Sunday afternoon in April. We applied online for him. And we went to that website. So this one right here, the www.ssa.gov/Medicare. Applying online during the initial enrollment period means that the person is turning 65 in the next 3 months and they want to fully enroll in the Medicare system Part A and B. Now, what was problematic when Dad and I sat down is they don't make it clear when you're going through what is Part A and what is Part B. So again, Dad doesn't have to apply for Part B. So the outpatient services, he doesn't need that because he still works at his job full time. And so he doesn't need Part B. He needed Part A. Part A is the in-hospital or in the facility treatment. So we went to the application site. We applied for Medicare only because he wasn't applying for Social Security at this point. And they say that it takes about 15 minutes. It took way longer than 15 minutes. So the first thing is that some of it, my dad maybe wasn't prepared. So you need things like your driver's license. They ask for that. They ask for your Social Security card. You have to upload these things. And so he didn't have all of those things on hand. The other thing they do is that they send you a code on your phone, as a security measure. So my dad was frustrated because he had to have his phone there at the same time that I was applying online. Now, I know that it was stressful for him. And I think some of it was he's just not of the generation where you jump online and do everything online. So I think that was part of the stress. And also, like I said, the website doesn't make it real clear as to how you navigate through this. So just as a way of summary, Dad and I applied on a Sunday afternoon. And what happened was that next Saturday, he got a phone call on his cell phone. I don't know why it was on a Saturday morning. And I remember this because I was working on some stuff for work at home. And he got a call, and it was somebody from Social Security calling to confirm some things that my dad had disclosed on this application and making sure that he was enrolled properly in Medicare in Parts A and Part B, or Parts A in his case. So the woman called, left a message on Saturday morning asking Dad to call back. So Dad did call back on that Monday, and it was just confirming his identity and confirming that he was still fully employed. They asked him questions about his employer so that they could confirm that. And then after that, my dad received his Medicare card within 2 weeks of that phone call. So he did make it through the application process okay. A little scars from having to put up with me on a Sunday afternoon, but he did get it. So we went through this whole process. We did see the receipt on the screen. We did print it for our records. We did get a confirmation number that we could log back in and check the status. Dad wasn't doing that. I kept that so that I could log in for him and do that. And then the Social Security Administration reviewed the application and contacted Dad a week after. It was actually less than a week because it was that next Saturday. So she just needed clarification because we had inadvertently tried to apply for Parts A and Part B when we applied online. So she needed to confirm that he only needed Part A. And then we did receive the determination letter with his Medicare card. I actually believe they were two different things. So he received a letter saying that he did qualify for Part A, and then he received a second letter that had his actual Medicare card inside that. So delaying enrollment. So my dad fell into this category. So he was actively employed, or if you have a spouse who's actively employed, and covered under the group health insurance based on active employment. Now, the one thing I will tell you is that you have to check with your employer, because if the employer, I think, has less than, I think it's 20 employees, then Medicare actually becomes the primary insurance. And so you still need to apply for Medicare. You can't defer. But my dad actually works for the federal government, so he did meet the criteria of active employment. There were enough employees, so he received delayed enrollment, but only as it related to Part B of Medicare, not Part A. He still had to enroll for Part A. You can later enroll in Medicare when that employer group health insurance ends, and you have 8 months to enroll. So the numbers here drive me crazy. So it's a 7-month initial enrollment period, including the month you turn 65, but you have 8 months after you are separated from your employee, whether it be you're retired or you're fired. You have 8 months that's a special enrollment period. And how you have to handle that is if the person is over 65 and they postponed enrolling in Medicare because of the employer health benefits, and that person is either terminating employment or retiring, then that employer health benefit ends. So the individual has to complete 2 forms. So my dad will have to do both of these forms. And it's an application for enrollment in Medicare. It's the CMS 40-B or CMS L564, which is a request for employment information, and that's just evidence for employer health coverage. So you have 3 options to submit those enrollment forms under that special enrollment period. You can go online and complete the form online and upload the employer part. So again, that's just evidence of the employer health coverage. So you can fill out one of them online, upload the other, or you can mail them both and the evidence that's required to the local Social Security Administration field office. Or you could fax the forms and the evidence to their fax number, which I have listed there. Again, their preference, unless you're having issues, is to do it through the online system. So that's the way most of our clients have been doing it, is uploading and completing the forms online. So when you're completing the forms, you have to write on the form that you want Part B coverage to start and you want it to begin, and then put the month and the year on there. And normally your employer is going to complete this. However, if your employer won't complete it, then you can complete it on behalf of your employer without the employer's signature, and then you can submit one of the following forms of secondary evidence. Either your income tax form that shows healthcare insurance premiums that were paid, a W-2 that reflects the pre-tax medical contributions, pay stubs that reflect health insurance premium deductions, health insurance cards with a policy effective date, an explanation of benefits paid by the employer's plan, or statements or receipts that reflect payment of health insurance premiums. Now, I have never had an instance when the employer wouldn't complete the form, and it's honestly a lot easier if the employer will complete it, because then you don't have to submit all of the supporting documentation. But if that's the case, I would probably upload or submit all of these things, because, for example, I know when I've applied for things online through the government, the issue has been it's always that one piece of evidence that you did submit, that's the one that they need. So to the extent that you have all of a copy of all of these things, I would actually upload or submit all of them, just so they have a complete application when you're doing it. If you're unable to apply online, you can contact the local Social Security Administration office. They are closed to in-person appointments, but you can still send it because they can receive the mail and process the paperwork. And then they can mail out the necessary forms. Now, note that when you're initially applying for Medicare, this is not an option. You have to do it online or on the phone. This is only during that special enrollment period when your employer coverage is stopping. That's when you can contact the local Social Security Administration office. Complete the necessary paperwork, so there's 2 forms, and you can mail it back to the local office. We recommend that you mail it certified mail, or you can fax it to this 1-800 number, and then you have confirmation of the fax. So either way you do it, when you're submitting the forms, I would always make a copy of them so that you know what you submitted, just in case there's paperwork that is lost or they don't get it all. I would always make a copy of what you also sent in. Okay. So number 5, let's talk about Medicare cost sharing and private insurance products as part of Medicare coverage. So I was shocked at how much my dad got mailings from different insurance companies wanting him to enroll in their program as opposed to the traditional or original Medicare program. So I'm going to talk a little bit about that and why that's a benefit and why that can also be a negative depending on what you're trying to accomplish with your Medicare coverage. So cost sharing was intentionally built into the Medicare system. So beneficiaries are expected to pay a share of the cost coverage through deductibles, co-payments, and co-insurance. As a result, you might need to do private insurance to help with the cost of that Medicare coverage. Now, I say you might because depending on your age and the facility and your financial situation, you may be able to qualify for Medicaid, which would pick up anything that Medicare does not. So I'm a visual person. So these are your different options. These are your different Medicare coverage options. You can do Medicare Parts A and B. So remember, Part A is the in-facility or the hospital, in the hospital treatment. Part B is the outpatient services or treatments. So you can get Medicare Parts A and Part B and be covered by your employer benefits through private coverage. You can go through Medicaid benefits, or you can get private insurance that's directly obtained by the beneficiary. So those are your 3 options for Medicare: either employer benefits, Medicaid benefits, or private insurance. So Medigap is supplemental insurance for Medicare Parts A and Part B. So you're still keeping the traditional or the original Medicare, and you're just getting a Medigap. So this would fall under this one on the far right with the private insurance. You're getting a Medigap policy to fill in for that, for the holes that Medicare doesn't cover. Part C is actually an alternative private insurance coverage. So it's an alternative to Medicare Part A and Part B. So we have the traditional Medicare Part A and Part B, and then we have Part C, which is typically they're called Advantage plans. So that takes the place of Parts A and Part B that you normally get through Medicare. And that's what my dad was getting in the mail. He was getting all kinds of mailings talking about these different insurance options that would be an alternative to Part A and Part B. And the reason why this is such a big deal to know what the difference is because there's always pros and cons. So the government is, of course, trying to get you to do Part C, to do an alternative to Medicare Part A and Part B, because it's less that they have to pay. So what they do is they're kind of locked in with these other insurances. They pay a certain amount, and then you get your coverage through that insurance. Now, the benefit of this other insurance is they may have additional coverage. So they may cover more things. You may be able to get dental, eye, all of that. The premium might be less. But the flip side of that is that then you have to worry about the providers and do they accept it. So with Medicare, traditional Medicare, the Parts A and Part B, usually every provider is going to accept that. But if you're under Part C, an Advantage plan, which is in place of Parts A and Part B, sometimes providers or your healthcare professionals do not accept the insurance that you're getting through Part C. So you may have a lower premium, you may have a larger range of coverage. So one of the things I saw on my dad's mailings was they were giving him free gym membership, like so much towards a gym membership as part of those Advantage plans, which would be a Part C plan. So they were trying to entice him. The other thing is that premium. So remember how we talked about Part B has a premium based on your income, your adjusted gross income. The premium may be less for an Advantage plan under Part C, but again, it all depends on the coverage. So the best coverage, meaning that the most providers are going to accept Parts A and Part B. The premium may be higher. Part C, the Advantage plans, they may be a lower premium and they may cover the eye and the dental, but not every provider is going to accept them. So that's the pros and the cons of those two different options. And then Part D is a prescription drug coverage. So these are basically your two options. The basic Medicare, which is Part A and Part B, where that's the primary coverage. Then you have a Medigap plan and a Part D drug plan. So that would be what your Medicare looks like. An option 2 would be that you don't do Parts A and Part B, you're instead under a Medicare Part C, which is like we talked about, those managed care plans is the primary coverage. So some other health insurance company is providing that coverage. And Part D can be included. That's one of those added benefits. So they might allow for your prescription drug coverage under a Medicare Part C plan. Access to Part C requires enrollment in basic Medicare. So again, you still have to go online and apply for basic Medicare Parts A and Part B. You're just choosing to actually be covered under Part C or a different program, but you still have to enroll. So I feel like these visuals are very helpful for clients to understand. So you have two options when it comes to this. And again, the first picture that showed the different ways, so when we go back here, let's just picture right here. So my dad is under the left picture. He has employer benefits. So he has Medicare Part A, and then he's getting his employer benefits. Medicare Parts A and B for the second one, and Medicaid covers. The visual that we're talking about now is actually the third one, Medicare Parts A and Part B, where private insurance is covering it. So that's what you're looking at here with these two options. You can either do basic A and B with a Medigap, or you can do a Part C that might have D as part of that overall plan. And then we have to worry about the donut hole. So Part D deals with the donut hole, and it's not as scary as it used to be, and that's because the rules have changed a little bit. The donut hole described kind of the lack of coverage when it came to a prescription drug plan. So here's a visual that shows that. So there might be a plan deductible, if there's any. Then when you get above the deductible, then the plan's going to pay for 75% and the beneficiary is going to pay for 25% of the drug coverage. Then there's an initial coverage limit. Then that's where we get the coverage gap, which is a donut hole where you're not getting any coverage. And so you're going to see it's between 4,100 and 6,500 is where that donut hole is. And then once you get over the out-of-pocket limit of 6,500, then the plan pays for 95% and the beneficiary pays for 5%. And that's designed for catastrophic coverage. So it used to be that we had a much larger hole in our donut, but in recent years, we've seen that shrink so that now you're just talking about a much smaller hole. It's still there, but it's not as large as it used to be for Medicare prescription drug plans in 2021. So you do get, so coverage through the donut hole, you get a 75% discount on plan covered non-generic drugs, and you get a 75% discount on plan covered generic drugs. Okay, so we're going to touch on Medicaid a little bit. So Medicaid is a health benefit program for individuals with low income and resources. So again, that's where Medicare and Medicaid are different. Medicare is anyone over the age of 65 who's going to enroll in this, otherwise you're going to have a penalty, or you have to be covered by your employer. Medicaid deals with low income and resources, and that's funded by federal and state allocations, and it's actually administered through each state. So Pennsylvania administers it through the Department of Human Services. So why do we mention this? So there are multiple ways that you can get in through Medicaid. And I'm talking about this because we have a lot of clients who are what we call dual eligible. So they're eligible for Medicare and for Medicaid. So in our picture, they're under, let's go back here to our picture, they're under the middle visual. So they have Medicaid benefits to pick up what Medicare does not cover. So that's why I wanted to talk about this. So there's some eligibility requirements, and it's talking about the federal poverty level. So, you have to be below certain percentages in order to qualify for this. But the last one is nursing home Medicaid. And that's where we are able to do some planning techniques to help protect assets if you would want to do that. And we do this a lot of times because husband and wives, we may have one spouse who needs long-term care and is going to be admitted into a facility. And if all of the funds go to pay for that spouse's care, the spouse that's in the community, the one that's not in the nursing home, may be financially compromised. So one of the things that we do here in our office is we try to protect assets so that we can ensure that both husband and wife, both spouses, are going to have the financial stability that they need in later years in life. So how do you coordinate those two? So we call them dual eligibles. These are people who are eligible for both programs, both Medicare and Medicaid. And how that works is Medicare pays first, Medicaid pays second. So again, they qualified for Medicare because of their age. Medicaid's kicking in because their assets are either protected and aren't available, or they've spent down enough and don't have the assets, so they're below the federal poverty line, and Medicaid's going to cover in. So they're called dual eligible. So basic Medicare, the red, white, and blue card that was on the one visual that we had, is the primary coverage. And then Medicaid is the secondary coverage to Medicare and will also cover things that Medicare doesn't cover. So dental and eye care. Medicare Part D is the drug coverage that uses the plan ID card at the pharmacy, and you can change your Part D plans at any time, and you can change them multiple times if you need to do that. The access card can cover drugs and classes that are excluded from Part D. So there's a lot happening on this slide. So just know that if you are under Part A and Part B, the traditional or the original Medicare, and you have a Part D plan to cover your prescription, you can change that multiple times. But what's interesting is it's very difficult once you've selected either traditional Medicare or Part C. So again, you can either pick Part A and Part B together, or you can opt out of both of those and go to Part C. Once you select one of those two options, it becomes very difficult to change it. There are ways you can do it, but it has to be during certain times or certain triggering events that you can switch to the other. So I always like for clients, everybody has to apply for Medicare, but it is a big decision. So it's talking through what does the individual want? What does this client want? And making sure that they're getting the best coverage for the least amount. So dual eligible individuals, you're going to see the Medicare Part A and Part B. Then Medicaid is taking the place of an employer coverage or private insurance like a Medigap. And then we have the Part D, which is the prescription drug. The special needs plans, these are the Medicare Part C Advantage plans, and they're considered special. So the abbreviation for that is SNP plan is the primary coverage. So this Part C Advantage plan is the primary coverage. You have to use in-network providers, and typically it does have a Part B drug coverage included in that. And you can change plans or disenroll and return to original Medicare Part A and Part B as a primary coverage at any time of the year or multiple times, but it has to be for some triggering event, okay? Medicaid still functions to cover things that Medicare or the Medicare Part C, that SNP plan, does not cover. So the way it functions with Medicaid is still just like it does for the traditional Part A and Part B Medicare. But this is what it looks like. So instead of having Parts A and Part B, it now has Part C, the SNP Advantage plans, and then Medicaid picks up anything else. And then we have a Part D, which can be part of the Part C coverage, or you may have a separate prescription drug program in there. Now, I wanted to spend some time talking about community health choices. And the reason why is that this is a newerish program in Pennsylvania. So Community Health Choices, or CHC, is Pennsylvania's program for delivering Medicaid services. So again, long-term care services, whether it be in the home or in a facility. So when we say HCB waiver services, that would be if someone's able to stay at home and we're able to just have somebody come into the home and provide care. The Community Health Choices is the program that Pennsylvania has adopted in order to deliver these services. So it started in January of 2018, and what they did is they broke Pennsylvania up in different quarters or like different areas, And community health choices rolled out in those different areas at different times. So southwestern Pennsylvania was first. So the Pittsburgh side of things actually came in first. Then they went over to Philly and then had community health choices roll out in Philly in the Philadelphia suburban areas. And then here in the center of the state, we had a different rollout period. So it was just so that they could transfer everybody over to this new program. And initially, I thought that this was really confusing, but as we're dealing with it, it does make a little bit more sense. So community health choice is just the overarching program that Pennsylvania now uses to provide these services. And what they do under community health choices is the state pays what we call managed care organizations. And this is where it is a little bit annoying because attorneys and other professionals in this area start throwing out acronyms. So they're called the MCOs, the managed care organizations. So community health choice is the overall name of the program, just like Medicare is the name of the program. And then managed care organizations are those organizations that Pennsylvania pays a fee. And they pay a fee so that these companies will provide Medicaid coverage for dual eligibles, so those that are getting Medicare and Medicaid. It can also, the managed care organizations or the MCOs are providing long-term services and support. That's what the LTSS stands for. So long-term services and support for those that are eligible for Medicaid. So they now call it, as if it's not confusing enough, managed long-term services and support. So now we just throw an M before it. So enrollment isn't mandatory for those impacted. You don't have a choice. And the issue with this is that you're going along, enjoying your coverage as it is, and then immediately in January 2018, 14 counties in southwestern PA now had to deal with this managed care organizations and shuffle all of their dual eligibles, people who are on Medicare and Medicaid, had to shuffle them to this new program. So it's taken a little while to work out all the kinks. So it affected us January 1st of 2020. And the good news is that the big cities in the corners of Pennsylvania had to deal with it first. So it was a little bit easier of a rollout for us here in the remainder of Pennsylvania. Hasn't been perfect by any means, but it's been a little bit smoother than Pittsburgh had initially when they had to enroll in it. And they did that because they didn't want these managed care organizations to get bombarded with all of these individuals who had to switch over to this new program all at once. So they kind of enrolled people in waves, if you will. So again, we have community health choices. That's just the new name for the new program. And as a result of this, community health choices is the program by which the state is paying the managed care organizations a certain fee. 3 companies that were selected for Pennsylvania, and they were announced August of 2016. They all operate statewide. So we have Amera Health Caritas, we have PA Health and Wellness, and then we have UPMC Community Health Choices. So these are the 3 options. So every person who's enrolled in Medicare and Medicaid is going to fall into one of these 3 options. This is the managed care organization that helps deliver their long-term care services to them. So anybody who's receiving long-term support and services through attendant care, independence, or aging waivers, so that affects anybody who is able to stay in their house, but they're having somebody come in and provide care. It affects those individuals. It affects those individuals who are in nursing homes that are being paid by Medicaid, and any other individual that's a dual eligible. So whether they're not actually receiving long-term care in a nursing home, they're still going to be impacted. So now the access card is no longer used because it's community health choices. It's a completely different program. Instead, they're enrolled in a community health choices managed care plan for medical assistance. So it's just a different way that Pennsylvania is administering their long-term services and supports. So the primary insurance is still Medicare. Part A and Part B is still the primary coverage, or if you're enrolled in the SNP, then it's Part C, those Advantage plans. So you're still under that. Now what happens is the community health choices plans have companion Medicare special programs. So those Part Cs, they're now required to enroll in those companion programs. So when my dad started getting all of these mailings, he's getting it from the program of community health choices. And again, anytime he gets that, it's just offering him an alternative to Parts A and Part B of Medicare. Now, Now we have an independent enrollment broker, or an IEB. So an IEB is the organization that provides counseling assistance to help individuals to choose one of those three managed care organizations. So these three that were listed on the slide, the independent enrollment broker is advising those individuals who qualify for Medicare and Medicaid which of these three they should go into or enroll into. So, provides assistance to choose the managed care organization, provides enrollment assistance to help individuals enroll in those different organizations, and then coordinates the managed care organization enrollment. So, what that means is that now our office, as well as any other financial institution or nursing facility who is applying for Medicaid benefits for someone who's also on Medicare, now has to go through the independent enrollment broker, the IEB in Pennsylvania. And the IEB, the independent enrollment broker, is Maximus. That's the company name. So Maximus is who we have to go through if we're trying to coordinate those benefits. So the application has to be filed through Maximus, and they're really kind of the director in all of this. So there have been a lot of concerns, and the independent enrollment broker contract is being renegotiated at this time. So it's all about, how do we make sure that we're having an independent enrollment broker who's really working for the best interest of our clients. The answer to that is we're not going to know. We can advocate as best we can, but until they secure the contract, we won't know. Also wanted to let you know that we offer our monthly virtual seminars. So again, it's just something nice we like to do for our clients. So our next one is on July 1st, and we're doing I Forgot Common Mistakes in Estate Planning. We're going to go over those and have some fun slides that we can work through, maybe some fun problems, and see if we can figure out logical and simple solutions for those concerns. So you can register by emailing Amy Meek at skwlawoffice.com or calling our office. We also do take registrations on our website, so you're welcome to do that. And if anybody on this call, if you have suggestions or maybe recommendations about upcoming virtual seminars, you're always welcome to reach out to us. And we're also looking for opportunities to partner with anybody if they have a topic they would like to and would like our office to also present. We're happy to do that as well. So that being said, I'm going to stop sharing my screen. Thank you all for being here. I really, really appreciate it. I'm going to stop recording for now so that I can then take questions. And if you want to be on video and ask those questions, you can do that knowing you won't be recorded. So thank you so much. This has been Samantha, the Law Offices of Samantha K. Wolfe. Thanks for joining.